Hi everyone, and welcome to Veterans in Crisis podcast. Today we're lucky enough to have Dominic Harvey and Simon Williamson, both from the NHS. Dominic's a social prescriber, Dom as we call him, and Simon is a health coach. Is that right?
Yeah, that's right. Yeah.
I'm glad I got that right and not the wrong way around. So sorry about the technical difficulties we've had earlier.
No problem. These things happen.
Yeah. So I'll ask you to come on and just describe basically your new roles, because I took you out canoeing the other day, just to show you what type of stuff VICS does in the type of social prescribing world. So I just really wanted you to come on and sell your service, really.
Yeah, I mean, that's great. Firstly, to your viewers, as Jer says, my name's Dom. I'm actually a veteran myself, so I served in the armed forces up until 1989. When I come out, I was with the Royal Signals. When I come out, I felt a bit lost and a bit trying to find my way in life. So I went to university and studied environmental studies degree. From there, I worked with adult social care and children's residential services, both secure and open. Then I did an educational role, then housing role. So I've been around the houses in relation to where I've ended up now with Sunderland GP Alliance. I'm currently the team leader for the Coalfields area. We cover the whole of Sunderland, so we'll have 6 team leaders covering the 6 primary care networks in Sunderland. In essence, since 2019, the NHS has been sort of in the process of transforming primary care, and part of this was to provide resources for GPs to keep and indeed improve on well-being of the community in Sunderland. So to that end, there was investment in social prescribing, which resulted in the teams that we have now. So each area, PCN, has a team of, firstly, a team leader, which is myself, which manages the team. Then I have a social prescriber within that sort of team, a health coach, a care coordinator, and a multidisciplinary team leader. So what is social prescribing for sort of viewers? Firstly, the process. So we've firstly got a care coordinator. So a referral comes in via the GPs. However, we've developed that. We've now got a self-referral pathway. So referrals, anyone can refer into our service. The care coordinator, what they do is they sift through the referrals. So they'll phone the patient. They'll ask the patient about, the current situation. And what sort of services can be assessed via that sort of initial assessment. They may come up to here. However, if they do come to us, then we'll sort of look at how we can help that patient, because often what we're trying to do is take the patients away to demedicalize. So take them away from the pressures that are currently on doctors, because often, yes, there is clinical issues, but more often than not, there's environmental and social issues which are causing the patient to end up the doctors asking for help. So in essence, what we do as social prescribers, we're covering a sort of number of areas. So the care coordinator, I'll take it in. When it comes to us as a social prescriber, we'll sort of look at various areas in relation to what the issues are. So it could be, for example, patient needs support around benefits or finances or the homeless and housing, which often, veterans in crisis, you're dealing with veterans only, I've got good systems in place already. So really, we're not trying to take away any sort of issues in relation to taking referrals away or veterans away from you. What we're trying to do is work with you as an organisation to see if there's anything we can do on top of what great job you're doing already.
I'll tell you one thing you could do, Dom. You could move along a little bit so we can see you're on the camera.
Oh, sorry.
I'm
not used to I'm used to talking, Dom.
I thought somebody was on the other side of the room. You were talking to, not me.
So all those areas, we can help with sort of health conditions. So Simon's the sort of the health lead, health coach lead. And people, when we talk about social prescribing, yes, we would deal with those, but Simon, I just want to introduce, covers sort of the health coaching side. So if Simon wants to have a quick word or mention about that side of things as well.
Yeah, I can actually see Simon.
Can you see me?
I can now. I think it was better when I could only see half of you.
Is that better?
Right, Simon, mate.
Hello, I'm Simon. I'm a health coach and I'm team lead for the east of the city, so city centre, down the east coast, down to Rye. So I work for the 7 practices within that area, but we have 6 health coaches working across the city, so covering all the local authority areas, so north, south, all of the areas, all the way down to Coalfields, Washington, right across the city. A little bit about myself. I worked for the NHS for 15 years, worked in specialist exercise and rehab. So we delivered all the cardiac rehab in Sunderland, all the pulmonary rehab, and we ran gym sessions and specialist exercise classes. I've worked for GP Alliance for the last year as a health coach, and I set the service up as a health coach. The role of the health coach is to work with patients with long-term conditions and help them identify behaviour patterns which are detrimental to their long-term condition. So I say behaviour patterns, it's lifestyle patterns, so physical activity, smoking, alcohol, diet, mental health. So we do a holistic assessment and look at all these areas, work on the principle of what matters to me or what matters to the patient. So we use motivation, empowering techniques to just come up with a plan. So it's a co-created plan between us and the patient. We don't lead, we don't tell patients what to do. It kind of comes from the patient. So we'll create a plan. Once we've got the plan going, we'll try and encourage the patient to make big changes. And we also look at trying to get patients into services. You know, so it could be physical activity services, it could be mental health services, weight management services, it could be anything. So as a health coach, the referrals we get are related to health conditions, so long-term conditions mainly. We get a lot of referrals for health prevention work, so coronary heart disease, things like that, diabetes prevention. We look to reduce the risk factors in referrals. So like I said, the main factors we work on is modifiable risk factors, so diet, physical activity, so blood pressure, cholesterol, things like that. Things you can change yourself to make that big impact in your health. It's a holistic approach. We can support people for up to 12 weeks. Work one-to-one, so it's mainly at the moment over the phone. There is scope on developing a weight management program, which will be rolling out next month, which will be a 6-week weight management program. We link with other services like social prescribers. Our referrals are always kind of a bit of both. So you might get a bit of health coach, a bit of social prescribers. So we'll kind of do a bit of both. If it's something we can't deal with, social prescribers will come in and vice versa. So what we work at as a health coach, long-term conditions. So the main ones, you know, coronary heart disease, diabetes, COPD. We work with a lot of social isolation, a lot of weight management referrals. Stop smoking, we link up with stop smoking services. We can give advice to that and refer into that. We do a lot of physical activity, so we link up with services. We've got a good deal at the moment with Everyone Active, where we can get things a little bit cheaper there. We also link with the new Tier 2 weight management program with the council, which offers free exercise and weight management advice. We're there to motivate clients, so you know you might have a weekly phone call to see how your week's going, and we'll just put plans and strategies in place. If things go wrong, to help you, when we say to help you, we don't give you the advice. We'll work with you where you come with the advice. You know the advice, you just probably need that a little coaching to get the advice, get the information out of you. We work with goal setting, so we'll set goal settings with patients. So it might be lose weight, it might be, you know, become more physically active, it might be to reduce your alcohol intake. And we're great for linking up the services. You know, we've got a big asset register of services we're linked up to across the city. And that's really about it.
Yeah, I think Simon made a really good point about there may be a set time of 12 weeks, but that's just as a guide. Often we could have patients up to a year. It depends on the individual, because as Simon mentioned, we do a holistic sort of assessment. Some patients, we need very little support, but some need hand-holding, so they might need to be taken to, if they wanted to get to the gym, but they've been socially isolated. So we might go with them initially, or meet them there to help them sort of settle in. Then we'll only withdraw an agreement with that patient. So we're trying to every opportunity for them to keep their independence, but to make sure that actually they do achieve that independence. We're not trying to take it away. We're trying to make sure it's maintained or improved on, really.
That's really what I did. That's what I really did with you when I had to carry your rucksack in it.
Tell you what,
I knew I was going to get that in. You just walked straight into that one.
It's behind that. I'm not going to make any excuses. My mountain legs weren't there that day. They had to help. No, but
it was England's highest mountain, though. You've got to give them that. So
yeah, it was more to do with my mountain legs. I'd never had them. But yes, it was a lovely day. By the way, I want to detract from the being out in the hills and being with a great set of people. You know, just from your staff and whoever else was there. It was a really good day. I thoroughly enjoyed it. And you know, it's things like that are really important.
It is really important. That type of thing builds morale. It builds camaraderie. It builds your fitness up. All that type of things. And what the good thing about it is you have a little taste of it and you want more. You know, whereas normally you wouldn't be doing it. So you know, they went back and climbed the whole mountain a couple of weeks later.
I've seen that. Yeah. I mean, it's a lovely experience to go out in the hills again. I think it's about 20 odd years since I last been in the hills, but I was very grateful to you that day to carry my bag and.
Don't worry about it, mate. You carried mine. You carried mine, and I had a bottle of water, a tuna sandwich, a packet of crisps, and an apple. But I ate the apple, so you'd scored there, didn't you?
Yeah, I definitely scored. But
yeah, I mean, we do all sorts. So you're always welcome to come and be active with us. You know.
I think that's really, really important to get the message out there. You know, the only way we're ever going to really achieve great outcomes for people is by working together and supporting each other. It works both ways. And I suppose today was just to let people know about what we do. And it's just to emphasize, it's any age range, and we work with families as well. Because I think it's really important when Simon mentioned the holistic approach that we do work with families. There might be occasions where you do get some veterans, or you get veterans' families contact you and they don't want to engage with any services, but they might decide, given a self-referral in time, they might just refer themselves in when they're ready, which then, you know, is helpful for them and everyone else if they have another option. I was just saying.
Well, I think the city-wide approach with every service helping each other, and you know, I think that's the way forward, because what I don't like is when you get a service and they sort of like, they're my clients, because that's not helping the client. You know, all that is about funding. So you know, you don't want that.
No. We just want the best interest for the client. So you know, we might have two services running the same kind of offer. We'll always go with the best, what's best for the client.
And that's
how we work.
Yeah, and we're always making judgments about, because services change. So you might have a service like, for example, I won't particularly name one, but there's one service that is a bottleneck in relation to befriending. So that service at that moment in time can't provide a befriending service. So then we won't just send a patient over and they can wait 18 weeks for that service, where we know another service provided. So it's about that quality, about what's best for that patient, always at the centre of any decision we make, which is, I know how you work.
Yeah, it's the only way to do it. I worked for a charity where they were all, well, that's our client, we mightn't get funding if, you know, and it's not about the money, is it? In this role, you're there to help people, you're not there to worry about money. If you're good at your job, money will come anyway.
Yeah, I mean, I know you grew your service from nothing, didn't you? It was a great shop, I think you said.
Yeah, from now. My office was Greg's.
Yeah, I'm surprised you haven't got a belly like.
No, mate. No, it's all a walking up hills, mate.
Yes, I know. I'm sure you have all been doing walking beforehand.
We walk all the time, mate. Usually just around the house and that one. Do you want to get anything else out before we put it in?
No, I think it's just getting that point across about that we'll take on anything really in any age group. So it's no to death sort of thing. So that's really important. And I think also it's about the point I want to get across is about working together. There's nothing we can't solve together. And if there's anything that you as an organisation needs from us, which is probably very little because you're so well established, we'll always be willing to listen and help and work, because it works both ways.
Well, brilliant. And the same goes for you. If you ever get a veteran that needs some help, just send them out.
Oh, definitely. There's no doubt about that. I'm very keen on that.
Next time we're doing something, is it as some of your team coming?
Anything, I could provide that it didn't work as. What I would like to do, I think, as we move forward, it'd be nice for the team to meet you face to face. I think on some occasions, and they have done through the activity. But I think it's always nice, isn't it, to see someone in the flesh.
Now everything's getting a bit back to normal. You should come and visit the ARV. Bring your team down.
Think absolutely, and I think also that from my perspective, again, before COVID, you had sort of time with your vets at a local pub, was it?
In the Gunners,
coffee.
The Gunners Club.
So when things like that start up, I'd like to come myself, for example.
It started up. It's on a Tuesday from 10 till 1, and you're a veteran anyway, so you can come anywhere.
So Tuesday 10 till 1, eh?
Yeah, and it's upstairs in the Gunners. You get free Greg's food, tea and coffee, and a bit crack. Well, not crack cocaine, just a bit chat. Just want to make that clear, all right? Any crackheads out there doing bother turning up?
Bit of coke, diet coke.
Right, cheers, lads. Thanks for coming on.
Great chatting.
And obviously we'll do something else. And while we're on, your boss Ash is there doing co-steering.
Yeah.
But she said she's scared of heights, but I said it'll not be very high once she jumps. So you're not very high.
Oh, when's that? When's she's doing that?
It's a Saturday. Where's my book?
But she needs to get some.
She does. And she said she was the one who asked about it, so she's got no choice really. The 16th or the 23rd of October, she's jumping off a cliff.
Or 23rd.
Yeah, 16th or 23rd, she's jumping off a cliff into the water.
Yeah,
tell her that.
I'll remind her.
Yeah, reminder. It's out in the open now. She's got to do it, hasn't she?
Yeah, exactly. Definitely.
Right, cheers, lads.
Thanks very much.
Been a pleasure, man. See you later.
Take care, man. Bye-bye.